But let's go ahead and get started. As a reminder, during today's session, we are going to be discussing some HVRP best practices. The National Veterans Technical Assistance Center, NVTAC, that's us, encourages all of our grant recipients to utilize best practices that may improve your service delivery. However, before you implement any practice that we discuss during this session, please make sure you consult with your statement of work and contact your grant officer's technical representative, that GOTR, to discuss if this is going to be an allowable cost or activity, or if it's going to require an amendment to your approved plan. So today we're going to cover benefits for veterans in a few different areas. In today's agenda, we're going to talk about physical health, mental health benefits, education and employment benefits. We're going to take a look at the GI Bill comparison tool and other resources before we close out with questions. So let's get started right into physical health. So as providers, we oftentimes get veterans who have physical health concerns or deteriorating health, and it's really important for us to be able to make sure that they're getting connected to that Veterans Health Administration or the VHA to address those physical health concerns. So some of our veterans may experience issues with combat-related traumatic injuries such as TBIs, those traumatic brain injuries, loss of limb or sensory organs, burns, and so on. Some of the most common chronic conditions, however, really are due to disease, which varies based on gender, age, socioeconomic factors, smoking and alcohol use, or the use of drugs. But it can also be a factor of maybe some of the areas geographically that they served. We've all heard of the PACT Act and some of the issues that are associated with burn pits or other toxins that we've been exposed to as veterans. The following is a list of some of the most prevalent conditions as reported in a study that was conducted by Unity Point Health. Things like amyloidosis or AL, which is often associated with exposure to herbicides, brucellosis, and I'm not a medical professional. If I mispronounce some of these, I do apologize. But brucellosis is common in Gulf War veterans, and Hodgkin's disease, which is also attributed to exposure to certain herbicides. Some other prevalent things that you might see with your veterans are that amyotrophic lateral sclerosis, or ALS, which is really an aggressive neurodegenerative disease that's linked to military service, among other things. Other things that are really prevalent, and I'm not going to go through the entire list, but you have Parkinson's, traumatic brain injuries. Well, this is going to be common for OEF veterans and Operation New Dawn veterans, which is typically closed by close contact exposure to explosions or highly concussive events. Certain cancers, the physical impacts of depression, which, yes, sometimes our mental health can have a lasting effect on our physical health as well. Respiratory cancers, musculoskeletal ailments, a lot of these really do fall right in line with those service-connected disabilities. And it's really important that we're able to connect our veterans to those veterans' health benefits for which they're eligible. And if they are not connected, it's important that we know how to help them do so. So that leads us right into how to access that U.S. Department of Veterans Affairs healthcare. So eligible veterans are entitled to free healthcare through the U.S. Department of Veterans Affairs, the VA, and accessing the VA really can be simple. Now, there are 4 options. And option 1 is applying by phone. Veterans can call the toll-free hotline between 8 a.m. and 8 p.m. Eastern, Monday through Friday. And there's the phone number that'll be linked in the resources here. Option 2 is to apply by mail. Veterans can fill out an application for health benefits, which is linked here, that VA Form 1010EZ. And all they have to do is fill that out, mail it in to this address here at the Health Eligibility Center in Janesville, Wisconsin. However, the most advantageous for those veterans that might have some of those cognitive impairments, or maybe they're just not as tech savvy, is to apply in person. They can download and complete the VA Form 1010 EZ either themselves or with help from somebody else, or they can go to their nearest VA medical center and get the form there. But go to that VAMC or a community-based outpatient clinic, a CBOC, where they can get help from somebody at the Veterans Health Administration to get connected. And the fourth option is through applying with the help of a trained professional. Veterans can work with accredited attorneys, claims agents, veteran service organizations, and with the help of a veteran service officer through their county or their state or some other veteran organizations like the Disabled American Veterans, AMVETS, American Legion, Veterans of Foreign Wars. A lot of those folks have trained veteran service officers that can assist veterans with filling out the intent to file the claim for service-connected disability, or just file an application to get connected to those benefits. So this is a really great way to help our veterans get connected to those health administration benefits. And yes, the process can be slow sometimes, but the application itself really shouldn't be that difficult. And if you do have veterans that struggle with that, help them out. So once you have your veterans connected to VA Health and they've got that benefit, they've got a primary care doctor through their local community-based outpatient clinic, and they're being seen regularly for specialty care at one of the VA medical centers. There may be times when they have to rely on alternatives to VA Health. So the VA health centers really are great resources for those things, the primary care, the specialty stuff, or expected situations. But in the event of a medical emergency, there are a lot of times, particularly in more rural centers or rural communities, where the VAMC or the CBOC could just be too far away. So it's important to know how our veterans can access emergency health care when the right conditions apply. If they feel that like their life or health is in immediate danger, always, always, always call 911 or get assistance getting to the nearest emergency department. A veteran does not have to have prior approval from the VA to go to an emergency room. This is a big misconception that a lot of veterans have. They think if I go to an emergency room and I'm a veteran and that's my only insurance, I'm going to have to pay out of pocket. The VA is not going to cover that. Well, that's not the case anymore. But there are certain rules that must be adhered to in order for the VA to cover the cost of that veteran's care. So the facility must be an emergency department. That's rule number one. A facility that has the staff and equipment to provide emergency care, such as a hospital emergency room, or it can be a standalone emergency facility. There are those standalone emergency departments. Urgent care facilities do not qualify as emergency rooms. Those do not count as emergency departments, and the VA will not cover that care. And the VA must be notified of the visit within 72 hours of when the care starts. If you go into a facility today, from the time that you walk through the doors and care begins, the VA must be notified within 72 hours. The VA really does prefer that the provider make that contact, but if the provider is dragging their feet and you just are not sure that they've connected to the VA, the veteran or an agent acting on their behalf can do it instead. Now, certain requirements must be met for the veterans not enrolled in VA healthcare. All right. In most cases, the emergency care and up to 90 days of related services can be covered, even if the veteran's not enrolled in VA healthcare. So that's important to remember. So if you have somebody that wants to get connected to benefits, and maybe they put in an application, but they've not yet been approved, that's fine. Go to the emergency room, notify the VA, and more often than not, the VA, if the conditions are correct, can again take care of the emergency care and up to 90 days of related services. Also, for non-VA emergency department visit rules, still going on with the veterans not enrolled in the VA healthcare. If the healthcare provider or trained crisis responder determines that the veteran is at risk of immediate self-harm, the VA can provide or cover the cost of care if they meet at least one of the following. The veteran was sexually assaulted, battered, or harassed while serving in the armed forces, or the veteran served on active duty for more than 24 months and did not have a dishonorable discharge, or the veteran served more than 100 days under a combat exclusion or in support of a contingency operation, primarily for the National Guard or Reserve components, and did not get a dishonorable discharge. The veteran should immediately let the emergency department staff know about their veteran status and request that the VA be notified immediately. And really do put the ownership of that contact in the hands of the provider. But again, if the provider does not make contact, let the VA know. So generally, there are certain eligibility requirements that must be met. So the VA can only cover the cost of a veteran's non-VA emergency department care if they meet all of the following requirements. One, the veteran is enrolled in VA healthcare or have a qualifying exemption from enrollment, and the VA healthcare facility or other federal facility that could provide the needed care was not feasibly available. What is feasibly available? Feasibly available means that it's close enough to get to for the required medical care to prevent the loss of life or a severe detriment. And the person with the average knowledge of health and medicine, or as they call it, a prudent lay person, would reasonably believe that a delay in care could have endangered the life or health of the veteran in danger. And all other above requirements are met. Again, let me go back and say that somebody does not have to be a VA enrollee to let the VA know and potentially have the emergency care and up to 90 days of care covered. But the VA will only cover the non-VA emergency care until the veteran can be safely transferred to a VA or other appropriate federal facility, unless the provider contacts the VA to do that transfer, and the transfer cannot be accepted because of maybe overfilled VA facilities. There's detriment to doing the transfer to the patient, or any other situation in which that transfer just cannot be completed at no fault of the veteran. So again, if a veteran is charged for non-VA emergency department care and the veteran reasonably believes that the VA should have covered the cost, this may be important because you may hear your veterans talking about, well, I've got these medical bills that the VA should have covered. And they have a fairly compelling argument for why that's true. Have them contact the VA at 877-881-7618. I've got that number right here on the screen. Jot that down, or it'll be in the recording later. And have them reach out and provide the evidence, and the VA may be able to make amends. All right. Moving on to mental health. So we know that sometimes the wounds that we come back with from our military service are those invisible wounds. So it's really important that we understand what resources are available to assist not only for the physical health ailments, but also for those mental health challenges that our veterans may face. Some of those most common mental health concerns, according to the VA, as of 2018, include things like anxiety disorders, depression, PTSD, schizophrenia or bipolar disorder, stress, substance abuse disorder, suicide ideations or attempts. And over 1.7 million veterans received specialized treatment in VA mental health programs in 2018 alone. So we're going to talk about some of these things and why this is important to understand. There really is a negative stigma of seeking mental health services, and Temitope touched on this a little bit in session 1. Veterans can often be afraid of seeking mental health services. The military drives it in that if you can't take care of yourself, if you can't complete the mission, you're in some way broken or unfit. And this is really untrue. And they really feel like after they separate from the military, if they disclose any mental health um, insecurity or mental health stress or anxiety or PTS symptoms, they're worried about disclosing this and being looked at as being less than. This negative stigma really is a barrier to veterans seeking treatment, regardless of the source. And it can be internally generated by the veteran or externally generated by others who view veterans as volatile, emotionally scarred, dangerous, or violent. And there's even the potential for veterans to be concerned about having firearms taken away if they disclose any kind of mental health concerns. Um, so there are a lot of things that really stack up to make veterans question whether or not they should seek treatment for what's going on inside. But it's really important for us as providers, particularly when we're working with homeless veterans who are at a heightened risk for suicide or mental health challenges, to really reassure our veterans that it's okay to not be okay, that there's nothing wrong. There's nothing that shows that they're broken, that they're in some way unfit to human. Be with them, reassure them that you're there, that you're not perfect either. Nobody is. Let's talk about things together and figure out the best course forward and help them get connected to the mental health resources that are there. So I'm sorry, that's a duplicate slide. I apologize. Or I clicked back. All right. So mental health services are available in the VA's mental health specialty clinics. They're available in CBOX and those VAMCs. But some of the larger VAMCs, there are actually VA staff that have integrated mental health staff as part of their patient aligned care teams or their PACs, which allow for services for PTSD, anxiety, depression, substance abuse treatment. And these are accessible without requiring separate consultations with mental health providers outside of those PACs. There's also the Veterans Crisis Line, which is available 24/7 to provide confidential crisis support for veterans, whether or not they are enrolled in VA health benefits or healthcare. Dial 988, press 1. Veterans can also chat online or text 838-255 to connect to somebody. Now, again, this is available to all veterans, regardless of their enrollment status in VA healthcare. And it's really important to understand that it's okay if a veteran is unsure. If they feel like they just want to talk to somebody, we can help get them connected to somebody to just process, and somebody who's a trained professional. It is not our job as HVRP providers to diagnose mental health situations or be the professionals in a mental health situation. But it is really important to remember that there is nothing that's more important than working with the life that's in front of us. Because at the end of the day, our veterans are people and they need help. And sometimes the best thing that you can do is just be there and work with them through these things. And maybe some sitting down and calling 988 with them is the best thing that they need. So there are other mental health resources outside of the VA, the crisis line, and things that you can utilize um, to help build your own repertoire. Right? VA Save is a training program that provides a helpful way to remember a step-by-step method of helping veterans who are experiencing suicidal thoughts or ideations. Save is offered through Psych Armor, and we're going to talk about Psych Armor a little bit more, but it just in a nutshell is a four-step thing. SAVE, signs, ask, validate, and encourage. Signs, know the signs that indicate a veteran might be thinking about suicide. What are some of those signs? Are they giving away their possessions? Are they just not interested in things that used to excite them before? Were they maybe at one point really excited about employment and now they're just kind of whatever. I'm just over it. Look for those signs that really are abnormal and out of the norm for that person and that individual's personality. And ask the uncomfortable question. Ask, are you thinking of killing yourself? Are you thinking of taking your own life? Don't ask questions that seek a no response, like, you're not thinking of killing yourself, are you? Because they'll be like, no, no, I'm not. Ask those questions and give them the opportunity to say yes. Are you having thoughts of taking your own life? You're going to see a much different response than you're not thinking of, doing something silly, are you? Have the difficult conversation, because an uncomfortable conversation today is better than a suicidal completion tomorrow. Validate the veteran's experience. Validate. Talk to them, listen to them, emphasize with them, and validate their experience. If a veteran is talking about something that's just really stressful, acknowledge that, yeah, that can be absolutely stressful. I can understand how that would stress you out. I feel like that would stress me out. I can understand why that would be upsetting. But let's talk about ways to really think about that and talk to them, make them realize that, yeah, okay, so the feelings that I'm feeling are okay. Somebody else gets it. Maybe I'm not alone in this. And encourage the veteran to seek treatment and expedite the process of connecting to veterans resources, mental health resources, again, such as the crisis line, community mental health professionals, or other resources that we're going to talk about here in a little bit. So I said we were going to talk a little bit more about Psych Armor. So Psych Armor, which is linked here, is a nationally recognized nonprofit training provider that really does provide some really great military cultural competency awareness training to members of the military connected community and anyone who wishes to engage with or serve veterans or the military connected population. Psych Armor provides training options for employees, board members, volunteers, service providers, and they offer flexible course delivery methods and online courses. These are, again, available for community members, educators, school personnel, employers, human resources. Just there's no end, to the number of people that can benefit from taking advantage of some of these courses. Again, they're online, they're free, VA Save, things that veterans wish you knew. There's just a ton of resources that are out there, such as the Military Culture Series, the Women Veterans Series, Respite for Military and Veteran Caregivers, Suicide Prevention for Military Connected Youth. Again, the VA Save, Firearm Safety and Suicide Prevention, Caring for Veterans through the End of the Life, and a ton more. So again, you know, take advantage of some of these trainings, implement them, and maybe include them in an annual rotation or maybe a twice a year rotation in your own internal training, because this information can go a long way to help your veterans who are experiencing some mental health concerns or suicidal ideations, but also help your staff and yourself to learn how to recognize the veteran in crisis. Again, as I said earlier, it's not our primary duty to be clinicians or for anybody who's experiencing a mental health crisis. However, it is everyone's responsibility to understand the warning signs and be able to take appropriate actions. Nothing that we do is more important than the preservation of the life we are interacting at that moment. This could be a veteran in your office, or it could be somebody that you encounter on the street. It could be a family member, a friend. Know the warning signs and know how to take time out for those folks. Again, some of those warning signs, talk about those feelings of hopelessness, or if they're talking about those feelings of hopelessness or having no reason to live. Are they expressing thoughts of self-harm or suicide? Are they withdrawing from friends, family, society? Have they started looking more deeply into the bottle or drugs? Are they experiencing dramatic mood swings or outbursts that are abnormal to their personalities? Are they giving away their stuff or saying goodbye to people, which doesn't quite fit their personalities? Are they sleeping too little? Are they not sleeping? Are they sleeping too much? Or are they expressing feelings of overwhelming guilt, shame? Are they talking about how they're worthless? Are they just inconsolable about one thing or another? And always remember that no statement about suicidal thoughts or ideations should be dismissed as a joke or not be taken seriously. And one thing that I want to share here is that maybe you have that veteran that does regularly call you, that does regularly lean on you for the support that you provide to them. If the phone stops ringing and they stop reaching out to you, take time to reach out to them, because that may be the time when they finally said, I've had enough. Call them and make the connection and let them know you're still there. So let's talk about some of those mental health resources for veterans who do not qualify for VA healthcare. Again, we've got that 988 lifeline. Don't need to have the don't need to have the VA enrollment. Sorry, that's the word. Don't have to have the VA enrollment for that. They can assist during difficult moments anywhere, anytime. The Cohen Veterans Network for post 9/11 veterans is a national nonprofit which is committed to helping veterans and military families by reducing those barriers to care. And the CVN provides high quality mental health care that's available to all post 9/11 veterans, including National Guard reserves, military family members, and more. They offer in-person services at their clinics as well as services via telehealth or via telehealth based on preference or need. To be eligible for that, again, have to be a post 9/11 veteran, including those from the Guard and Reserves, regardless of MOS, discharge status, or service length. This includes service members of all branches, including the Guard and Reserves, active duty, need TRICARE referral. Military family members of post 9/11 veterans and service members, including spouses and partners, children, parents, siblings. They really can help a lot of people do a lot of great things. Then you have your certified community behavioral health clinics, or your CCBHCs, which are designed to ensure access to coordinated, comprehensive behavioral health care. And they're required to serve anyone who requests care for mental health or substance use, regardless of their ability to pay, place of residence, or age. There are also federally qualified healthcare centers or health centers, or FQHCs, which are federally funded nonprofits, centers or clinics that serve medically underserved areas and populations. Federally qualified health centers provide primary care services regardless of your ability to pay. The Substance Abuse and Mental Health Services Administration, SAMHSA, has a national helpline that provides 24/7 free, 24/7 free and confidential treatments, referrals, and information about mental and substance use prevention, disorders, and recovery. For that, all you have to do is call 1-800-662-HELP. There is, again, all of these are going to be linked in the resource page as well. But then you also have the local community mental health, or the Community Mental Health Association. This is like a location-based kind of example. The Community Mental Health Association of Michigan, which is one example of what Michigan is doing. I encourage you to click on it, take a look, and see if your area has something similar. Then you have other resources that are out there that are free, that are for anybody. Your faith-based counseling, support groups. Oftentimes, public libraries or community centers may have free drop-in counseling sessions or resources. Universities may have mental health counseling through their mental health departments or their social services departments. Really look deeply into what resources are available in your area, because if you do have a veteran who does not qualify for VA healthcare and they need that mental health resource, please know what the resources are in your service area and get them connected. All right, and now we're going to move on to VA education benefits. So oftentimes the first step after a service member separates from the military, their first step is to seek post-secondary education, certifications, or some kind of skilled trade. So understanding how to connect our veterans to their education benefits really can go a long way in creating that training to employment pathway and help reduce the impact of having a gap between their expectations when they separate from the military and the reality of the education and the job labor market in the civilian sector. So when we're talking about education benefits, the primary one that most people are familiar with is the GI Bill. The GI Bill offers a lot of different degrees of education benefit to veterans and their family members under certain circumstances. And there are several different types of GI Bill that your program participants may have available to them based on their situation. Now, the GI Bill can offer 36 months and up to 48 months for those that paid into the Montgomery GI Bill without utilizing it of education benefits. So let's talk first about the post 9/11 or that Forever GI Bill, which offers education assistance for undergraduate degree programs, graduate programs, certification programs, registered apprenticeship opportunities, and more. So the GI Bill can be transferred prior to separation from the military to spouses and children of veterans for use at post-secondary institutions or private schools for high school age children that have a fee-based registration. And the percentage of tuition that the GI Bill will cover is dependent on the amount of active service each veteran has accrued, from 40% to 100%. Now, I will say when we're talking about veterans and getting them into training resources, again, these are great for 2-year programs, 4-year programs, graduate programs, but there's also more that it can do. So the GI Bill is not just limited, however, to the post 9/11 GI Bill. There are other options that you may have your veterans asking about, like how do they get connected to their Montgomery GI Bill for active duty or Chapter 30. And this is for veterans who served during certain eras for at least 2 years. You know, when I first went in the military, I'm a little bit older than most. We all paid into the Montgomery GI Bill, and that was supposed to be our be all and end all for education benefits. Then the post 9/11 came out, and that was just super awesome. So it's really important to understand that some people who serve during certain times may have an additional 12 months of use because of that Montgomery GI Bill. There's also the Montgomery GI Bill Select Reserve, or the MGIB SR Chapter 1606. And it's possible that this is a potential resource for members of the Army, Navy, Air Force, or Marine Corps, Coast Guard, and members of the Army and Air National Guard for reserves or National Guard. Then you have Dependents Education Assistance, DEA Chapter 35, which is available for dependent spouses and children of veterans who have died, are captured or missing, or are permanently and totally disabled due to a service-connected disability. All right. So for more information on all of these different GI Bill benefits and what they may be eligible for, check out the VA website about GI Bill benefits. Again, linked in the resource page. So it is important, and I am going to pause here for a second to understand that the GI Bill can also be used for certifications. It can be used for on-the-job training, registered apprenticeship programs. There's a lot of things that this can be used for. And we're going to talk more later on about the GI Bill comparison tool and how to locate resources for which the GI Bill can be used. So on top of the GI Bill money, there may also be federal and state tuition assistance. For service members, particularly who are still engaged with the military, they may qualify for federal tuition assistance or state tuition assistance, and each state does things a little bit differently. Here in Michigan, we have the Michigan National Guard Student Tuition Assistance Program, which pays X amount of dollars per year. Other states offer free tuition to state colleges and universities for anybody who has served in the National Guard or the active duty military, and they return back to that state. Just really look at what your state has to determine what is available for those individuals who are still serving. Now, it's important to understand the federal tuition assistance. Now, if you have somebody who is still actively in the military and active duty status, they may not qualify as a veteran yet. But you may have individuals who are serving in the National Guard or Reserves who qualify as a veteran because they've gone on deployment, those Title 10 orders, and have come back and now are using this federal tuition assistance. So they could qualify as a veteran and be using FTA or need help getting connected to FTA or their state tuition assistance, and they could still potentially qualify for HVRP funding. So another resource that we have, which is primarily an employment resource, but does offer education resources as well, is Veterans Readiness and Employment, VRNE Chapter 31. We all know it as voc rehab, right? I still call it voc rehab. A lot of people still do, but it's now veterans readiness and employment. Now, VRNE is a VA benefit that is not specifically for education again. It does provide, however, up to 48 months of education benefits for veterans who have a service-connected disability and meet certain qualifications. And what they're seeking in employment requires a degree. VRNE provides opportunities for college education, assistance with independent living, entrepreneurial opportunities, and much more. Now, it used to be that VRNE would directly impact the amount of GI Bills that somebody would have to use. For example, if you used 3 months of VRNE, now you've lost 3 months of GI Bill usage. However, that has changed, and a lot of people who used VRNE and lost their GI Bill got that time back to use their GI Bill again. But VRNE benefits must be utilized first. As an example, if you've got a veteran that really wants to get into a program that requires an advanced degree, VRNE might pay up to the end of that bachelor's degree, and then they could use that GI Bill after. But for more information on how to get connected, really look at va.gov and explore the VRNE options. And we're going to talk more about VRNE later on in the employment section. So it's important also to understand the timeline for using education benefits. It's not like every veteran now has an unlimited time, amount of time to use their GI Bill. For veterans like myself who separated on or before December 31st, 2012, there is a 15-year delimitation date from the time of separation for using the GI Bill. For anybody who separated on or after January 1st, 2013, there is no longer a cutoff date for using their GI Bill benefits. Again, we call it that forever GI Bill, right? Under the Harry W. Colmary Veterans Education Assistance Act of 2017, they backdated it to January 1st of 2013 and created the forever GI Bill, which completely removed the timeline for when people have to use the GI Bill. Now, veterans who are interested in receiving benefits through VRNE, that Chapter 31, typically have 12 years from the date that they receive their first notices of disability ratings from the VA, except under specific circumstances. All right. Now, we've talked a lot about the different education benefits, but it's also important for us to understand and recognize those barriers to education. There may be some significant barriers there. Family responsibilities, work, post-traumatic stress can have an impact. I know when I first went into my first college class, when I got out of the military, I went into a lecture hall at Michigan State University, Go Green, where I was sitting among about 250 other students, the majority of which who were fresh out of high school, young students, not my people anymore. I was an adult learner. I had a family. I had kids. I wanted to focus on the education piece. There were people throwing things. There were people sleeping. There was another couple of kids that were watching a football game in front of me. That was kind of distracting because I love football, but it really made it difficult for me to concentrate. And I really felt the walls closing in and I couldn't get out of there fast enough. But as I grabbed my stuff and got up to turn to leave, I had another gentleman in the back of the room flag me down. He was a Coast Guard veteran and he recognized what I was experiencing. So I sat with him and he helped me work through that. So that PTS can really be a deterrent to education. There could be those feelings of isolation on campus. Again, just like I was feeling in that crowded lecture hall, I felt isolated because I was around a bunch of people who were a lot younger than me that couldn't relate to me, that I had the military service and a different set of world experiences. I really felt out of place, but I still felt isolated. Your veterans may have struggles with technology or may not understand how to use Blackboard or some of these other online learning resources. Your veterans may have just an ignorance of the benefits for which they are eligible for. They may not know about the GI Bill. They may not understand VRNA. Help them understand those benefits and help them explore some of those different resources, either through the federal resources or your state resources. But the good news is that for all of these barriers, there are a lot more support services. There are so many great things through the campus career centers that might be able to help. Your student veterans groups might be able to help. Things like the Student Veterans of America or Peer Advisors for Veteran Education, which has numerous campuses across the country. There could be on-campus veteran centers where students can go and have a safe place to study, sit around other veterans, get a snack, have access to computers, all kinds of things, maybe even on-site veteran service officers that might come in and provide services. The school certifying officials are there to be an asset too, to help veterans who might be struggling academically. There are the offices of campus life that might be able to help veterans get connected, maybe not even necessarily to other student veteran groups, but maybe to other things that maybe resonate with the veteran, maybe intramural sports or hunting and fishing resources. There were shooting teams at Michigan State University that a lot of veterans really gravitated to learn how to, maybe shoot bow and arrow or understand agricultural hobbies, things like that. Friends and families can be a resource, but in the scope of your role, you can be a resource. You can help them, provide them a space to come and study. If they're going through an education program, provide them with a computer if they need, if you have the availability, or maybe help them study if you've got the time. Be a resource. All right, we're also going to talk a little bit about employment benefits. So this is kind of our bread and butter, right? We're a Department of Labor program. We're the Homeless Veterans Reintegration Program. We want to help our veterans find jobs. So one of the biggest challenges, and I think everybody on the call knows this, but one of the biggest challenges for veterans after they leave the military is struggling with finding gainful employment that can meet the financial needs of living in a civilian world. Again, when I got out of the military, there was a big difference between expectation and reality. In the military, I was a staff sergeant, 10 years in the military. I had a certain level of responsibility. I had a certain level of certain types of duties and leadership. And I thought I should be able to make a comparable amount of money with the same style of life. We all know that that's not the case, right? That's just very rarely the case. So according to the U.S. Department of Labor's latest numbers, and this is as of June 2025, so between May of 2024 and April of 2025, veteran unemployment, thankfully, was slightly lower than unemployment among non-veterans as a whole. So this is promising. This means that maybe some of the work that we're doing is paying off. Veterans with a disability had an unemployment rate of 6.5%, where non-veterans with a disability had an employment rate of 7.8%. So that's a full percentage point plus more than veterans. Where veterans with no disability had an unemployment rate of 2.8%, and non-veterans with no disability had an unemployment rate of 3.8%. Again, full percentage point better than our non-veteran counterparts. But this is for all veterans as a whole and does not take gender into consideration. If we drill down a little bit more and we look at the Department of Labor statistics, unemployment between veterans and non-veterans by gender in April of 2025, the highest population of unemployed job-ready Americans outside of institutions being situations of incarceration or inpatient mental health. The highest population of unemployed job-ready Americans was women veterans. Women veterans have an unemployment rate of 5.9%, where women non-veterans have an unemployment rate of 3.3%. Male veterans, 3.1%, and male non-veterans, 4.1%. So this is just an opportunity for us to really look at some additional services that we might be able to provide in additional contexts that we might be able to apply when we're looking at programming for our veterans within your own agencies. So let's look a little bit at transition assistance. So for veterans who are entered into your program and are still serving in the National Guard Reserves within 180 days of separation, and have met the qualifications for active duty service, they may qualify for DoD Skill Bridge. Now, Skill Bridge is an opportunity for service members to gain civilian work experience through industry-specific training, apprenticeships, internships during their last 180 days of service. It really does a good job to connect service members with real-world job experiences and provides opportunities to learn while still serving in the military. To qualify, the service members have to be granted 180 days of permissive duty from their chains of command to focus solely on full-time training. And they have to have that, again, written approval from their command teams. And there's a list of skill bridge opportunities, that are going to be linked here in this program. And one other resource when we're looking at veterans transitioning into the civilian sector is the DoD credentialing opportunities online, or DoD Cool. So DoD Cool is a collaborative product between the different branches of service to match military occupations to civilian credentials, like occupational certifications, licenses, apprenticeships. And each branch has its own cool website. And your veterans should really help them get connected to those individual branch specific websites to really explore different credentialing, whether it's maybe healthcare or law enforcement or truck driving or whatever it might be. Have them take a look and see what credentials are out there through the individual branch cool websites, whether it's Army, Navy, they're all there. So we're also going to talk a little bit about veteran workforce development support programs like HVRP. So we already know about the DOL resources. We're one, Jobs for Veterans state grants, where you've got your disabled veterans outreach program staff, your DVOPs at the American Job Centers. You've got your local veterans employment representatives or your leavers through the JVSG. They all work really hard to enhance the opportunities for the veterans. Now, your American Job Centers also have your business development teams who work to bring employers together and really increase opportunities for job seekers, including veterans, along with those other programs like WIOA, that Workforce Innovation and Opportunity Act, other training providers, employers of the day. They do a lot at the American Job Centers to really help with engaging your program participants with employment opportunities. But then there are those VA resources. We've already talked about VRNE, and we're going to talk a little bit more about that in a few. The Veterans Employment Toolkit, which provides tips and tricks on how to engage with the resources out there for tips and tricks on job applications, interviewing, how to format a resume. There's a lot there. The VA also has community employment coordinators who work with businesses to increase job opportunities. And then there's also the Homeless Veteran Community Employment Services. Really look at all of these resources and learn about them to see who the personnel are in your area and how you can get connected to them and implement their expertise into your practice and how you can rely on them to enhance the availability of opportunities for your veterans. Now, there are a lot of other support programs, and I'm not going to talk about all of these, but ONET Interest Profiler is a really great way to look at military experience or somebody's interests and skills and help them find careers that fit what they're interested in. There's the Veteran and Military Transition Centers, My Next Move for Vets, Hire Heroes USA, Paralyzed Veterans of Americans Veterans Career Programs, VA for Vets. There are really a lot of resources that are there to help us get connected to supports for our veterans. We don't have to try and do things all on our own. But now let's talk a little bit more about VRNE. So when we're looking at VRNE for employment purposes and not education purposes, we can really utilize it to expand on our search capabilities to find things like on-the-job training and registered apprenticeship programs. But you can also use it to find those employers that offer OJT. So it's intended to provide vocational, VRNE is primarily to provide vocational rehabilitation services, right, for those service-connected disabilities that create barriers to finding and maintaining suitable employment. So in this case, suitable employment really does refer to jobs that are in safe environments, that are sustainable, and do not further exacerbate a veteran's disability. VRNE can provide supports to assist veterans with certifications, degree programs to assist them with obtaining employment, or can assist with entrepreneurial opportunities, um, such as guiding the right veterans with the right business plans on how to access funding, how to write a business plan, how to do a lot of things. So VRNE really does a lot more than just the education piece. But that's going to take us up to that GI Bill comparison tool. And I touched on this, but it's really great for finding appropriate post-secondary education or training opportunities, which can be difficult for veterans. But it's also a good way to locate schools and employers, licenses, certifications, prep courses, and national exams. So for schools and employers, again, they can cover public, for-profit, private, foreign, flight schools, correspondence schools, high schools for those dependents that have the GI Bill transfer to them, and on-the-job training and apprenticeship opportunities. And veterans, you and the veterans can utilize the tool, however, to find license, certifications, and prep courses that are reimbursable depending on the nature of the test. So it may be used to locate national exams that the VA may cover under the GI Bill, such as the GRE or the GMAT, or maybe even the NCLEX for nursing students, teacher training tests for language aptitude, and much more. But it can also be utilized to locate schools and training resources by location, and can be filtered to search only for those job-driven training and registered apprenticeship programs, which can assist in locating eligible job-driven training opportunities and contact information for potential employers that you can establish relationships with. So if you go in and you search maybe by your zip code by a certain radius, and you click on something that pops up, it may bring up a certifying official or an owner or somebody with a phone number, a name, an address that can just go further to enhance the network of employers that you have. So again, the comparison tool can be a useful resource for veterans who are seeking post-secondary education, certifications, training resources, or employment. All right, so again, we've got a lot of different resources here, and now I'm going to open it up for questions, and I'm going to stop sharing my screen. Again, if you do have questions, please do feel free to raise your hand, type your question or comment in the chat, use the raise hand feature, and I can enable your microphone. Just let me know what you would, if you have anything you'd like to add. All right, I'm seeing none. All right. Oh, yes. Kaylin says, are there any resources or ways where we are battling transportation issues other than public bus routes? So transportation is definitely one of those challenges, particularly in the more rural areas. And it really just depends on what availability you have. Now, there are some areas, and again, always go with what's allowed in your statement of work and consult with your GOTR. But there are some instances where you could potentially rely on gig economy transportation resources, ride share opportunities, or working with your county veteran service offices to see if they've got any resources for veterans transportation, resources maybe through the county veterans affairs or the disabled American veterans. Particularly, those are really good for connecting veterans to healthcare appointments and things like that. Now, I know that may not be a one size fits all solution. However, I know that there are certain programs that have developed um, for it's almost a for-profit model of getting approval through Medicare or Medicaid to reimburse for rides and having staff drivers. If you've got something like that in your area where transportation can be a billed thing through another resource, just take a look around and see who's out there and what may be available in your area. Thanks for that question. Are there any other questions or concerns or comments? Again, you can click the raise hand feature or drop your questions in the chat. All right, seeing none. All right. Well, again, I want to thank you for taking the time to um, attend this VLC on education, health, physical health, mental health, and employment resources. If you have any questions or if you would like to engage with NVTAC, please do email us at nvtac@dol.gov. And also, please do take time to click on the link that Jen just dropped in the chat and complete our survey. We love to be better tomorrow than we are today, and we can't do that